AAPI is a forum to facilitate and enable Indian American physicians to excel in patient care, teaching and research, and to pursue their aspirations in professional and community affairs. AAPI USA has been engaged in harnessing the power of Indian diaspora from all over the world to bring the most innovative, efficient, cost-effective healthcare solutions to India. Since 2007, with the launch of the first Indo-US Healthcare Summit in Delhi, under the leadership of Dr. Hemant Patel, the former President AAPI, and Mr. Anwar Feroz Siddiqui, the Honorary Advisor. Since then, AAPI has made significant progress, and under the leadership of Dr. Jayesh Shah, President AAPI, has seen major transformation into a global healthcare summit, which was held from 2nd January to 5th January 2014 at Ahmedabad Management Association. AAPI would like to make a positive, meaningful impact on healthcare in India. The mission of AAPI is to share best practice and experience from leading experts in the world and develop actionable plans for launching demonstration projects that enable access to affordable and quality healthcare for all people. To accomplish this mission, AAPI is backed by leading healthcare experts and professional associations, including Ministry of Overseas Indian Affairs and Indian Development Foundation, and Ministry of Health and Family Welfare. AAPI has organized 7 Indo-US Global Healthcare Summits and developed strategic alliances with various organizations. It is these learnings and relationships that have now enabled them to plan ahead and prepare for outstanding events that has already received confirmation and endorsement from over 300 very prominent and talented physicians and surgeons that are very passionate about serving their homeland, Mother India. In addition, several international healthcare industry partners are looking for opportunities to participate in these events for greater collaboration on research and development and philanthropic engagement.
I would like to request Dr. Srinivas Ramaka to please come forward. Dr. Srinivas Ramaka, he is the chairman and managing trustee of the Srinivasa Heart Foundation in Warangal, Andhra Pradesh. Involved in community cardiology programs from 1999. In 2011, he was speaker at the World Heart Federation workshop at New York. He initiated a free tobacco cessation program at Warangal. He has received numerous awards from Warangal and Andhra Pradesh medical societies, the IMA and WHO for his work for the community. AAPI is proud to present the 2014 Global Healthcare Summit Award for Community Service to Dr. Srinivas Ramaka.
I am Dr. Srinivas Ramaka. I am a non-invasive practicing cardiologist from Warangal, Andhra Pradesh, India. Warangal is a place of around 10 lakh population in the southern part of India. In 1999, when I started my practice, I found that most of the patients coming to me have a lot of relevant questions regarding the symptoms of chest pain, of symptoms of cardiovascular disease, how a patient with cardiac problem should be investigated, what are the various modalities of treatment, and how to prevent heart disease. With this background in mind, from the questions which patients ask me routinely, I devised a program what is called as a Know Your Heart program in the local language. Now, as you know, India is a country with diverse linguistic background. So initially I started with the framing the answers for the questions of the patients in the local language, Telugu and from the background which I hail from. And then the Know Your Heart program, from the anatomy of the heart to the symptoms, the working of the heart, the symptoms and signs of heart disease, how a patient with heart disease is investigated by a practicing physician, the treatment modalities of heart disease, different types of heart disease and the treatment and prevention of heart disease, and that's how the Know Your Heart program has evolved. And for the first time in 2007, when it was applied for the Louis Lown Heart Hero Award, though it was not an award winner, this was a finalist for the Louis Lown Heart Hero Award from of the Lown Heart Foundation in Boston. Subsequently, I found that there were some persons who come from a low resource, inaccessible background, who are not accessible to cardiovascular services. I chose the jail prisoners of Central Jail Prison, and I evaluated around 700 prisoners. And there was a free cardiac evaluation for all the inmates of the Central Jail, and that also became the Louis Lown Heart Hero finalist in 2009. And though we have been doing the Know Your Heart program in each free camp which was conducted. Now, in India, there are certain groups which are not accessible at all for cardiovascular service, starting from the rural areas. So I devised a program for the rural areas where we go with a questionnaire, starting from the name of the person, address, and the symptoms of heart disease, and the risk factors for heart disease. And in each area hospital and a primary health center in Warangal, Andhra Pradesh, we started a rural health initiative for cardiovascular disease diagnosis and prevention. This also came under the Know Your Heart program. Subsequently, I found that during the practice, I get a lot of patients who are brought dead, and some of them are youngsters who have been using tobacco. So we started focusing on tobacco prevention from then on, from 1999 onwards, and every year the World Heart Day, which is on 29th of September, every year, and which was earlier on the last Sunday of September, and the World No Tobacco Day, which falls on the 31st May every year. We have been doing the World No Tobacco Day also, and from the ground level, from the consultation room, the prevention has to start, which has to be extended to the community, and that throughout the national level. We started doing the tobacco prevention program, the implementation of the COTP Act, Cigarette and Other Tobacco Products Act, how it is implemented, and thereby contributing to tobacco prevention. And incidentally, the World Health Organization recognized in 2013 for the Southeast Asian regional organization countries, CRO countries, I was an award winner of the Director's Special Appreciation Award for Tobacco Prevention. These awards are only the part of the program on heart disease prevention in particular, and health aspects in general in India, which is of diverse backgrounds. Subsequently, because we see a lot of patients, lot of people in the country facing cardiac arrest, and unfortunately they don't survive, we started focusing on creating awareness on cardiac arrest in the country. As you know, the World Health Organization and the World Heart Federation, as per their studies, the awareness on cardiac arrest on CPR, cardiopulmonary resuscitation, is less than 1% in the Indian population. Even the medical personnel sometimes are not aware of CPR. For this, taking this into consideration, in Warangal, starting from 2009 onwards, and taking the 2010 new guidelines of AHA in particular, we thought that all the public personnel, like the staff in railway stations, airports, bus stands, NCC cadets, NSS, National Student Scheme, bank staff, railways, high school children, all of them above 13 years and starting from the high school 8th and 10th classes should be trained in CPR, and almost group sessions around 35 to 40 were conducted. And on 12/12/12 we conducted the largest session of cardiopulmonary resuscitation in the country, from 6 o'clock in the morning to 8 o'clock in the evening, in the night, where around 4,000 people on a single day were trained in CPR, and particularly on cardiac arrest, the cause of cardiac arrest, and then doing hands-only CPR and usage of an AED. And probably this is the single largest session and the longest session in the country. The thing in India is, we made Warangal as the first district probably in the country where the entire population is aimed at receiving the training on cardiopulmonary resuscitation, particularly hands-only CPR and in AED usage. My appeal to the government is, all these things, aspects of health in particular, tobacco prevention, training the lay public in CPR, improving the links in the chain of survival, like creating awareness, improving the ambulance services, training people in CPR, both the medical personnel as well as the lay public, creating and establishment of an availability of automatic external defibrillators which are not available in throughout the country, and improving the ambulance services in the country, and then improving the post-hospital care from the primary level to the secondary level to the tertiary care level would save at least many lives and thereby improve the status and the health status of the population. And with this in background, the cardiac arrest in particular and the CPR in general, we started, my aim is to create the knowledge on CPR in various Indian languages. Right now I am in the process of getting the CPR knowledge as per the AHA guidelines to different languages, Marathi, Gujarati, Tamil, Kannada, every Indian language with a script. The awareness on heart diseases, the knowledge on heart diseases in particular and health in general should be made available in the national language Hindi as well as the local languages in each state, and even the knowledge on CPR should be increased. Thereby, I hope that many lives would be saved, and I appreciate the initiative of the AAPI, the initiative of Dr. Vemuri Murthy and others from the APMG USA, and all Indian doctors who have come forward, and their cooperation along with integrating with the Indian organizations like IMA, Cardiological Society of India, and the government of AP and governments in various states would go further in improving the health status of a country which is supposed to be the largest democracy in the world. Thank you.